Hello and welcome to the Pinpoint Lecture in the Psychosis series. This is Dr. Nicholas Hatcher, and in this presentation we will explore the diagnosis and differential diagnosis of psychosis. Here is a reminder of where we are in the series. Now that we have an idea of what the presentation of psychosis entails, we are now turning our attention to specific underlying causes to consider, as this will ultimately guide management and prognosis. After considering the secondary causes of psychosis, we will now turn our attention to primary causes of psychosis. In concordance with the DSM-5, in each primary condition that includes psychotic symptoms, it is included as part of the criteria for the diagnosis to rule out any medical illness, medications, or substance use that may be contributing to the patient's presentation. Assuming we have done so, let's look at some of the primary causes of psychosis. In order to gain perspective of the primary causes of psychosis without being redundant during this lecture, let's review some key syndromes. When I refer to psychosis, I am referring to a syndrome including delusions, hallucinations, and disorganization of thought, behavior, and speech. This may or may not include negative and cognitive symptoms. Depression refers to a syndrome that can be recalled by using the mnemonic SIG-E caps. This syndrome includes decreased sleep, usually early awakening or hypersomnia, decreased interest, guilt, decreased energy, decreased concentration, decreased or increased appetite or weight, decreased psychomotor activity, suicidality, and depressed mood. Mania refers to a syndrome that can be recalled using the mnemonic dig fast. This syndrome includes distractibility, which includes racing thoughts, indiscretion or risk-taking behaviors and impulsivity, grandiosity, flight of ideas, increased activity, decreased need for sleep, and talkativeness. These three syndromes will be applied in the psychiatric conditions to be considered in the differential diagnosis of psychosis. In order to be classified as a psychiatric disorder or illness, the presence of what can be referred to as the 3 Ds must be present. The condition must be significantly deviant in that it is incongruent with social and cultural norms. The condition must be significantly distressful, as determined by the individual in their perception of the impact of illness and symptoms. Finally, the condition must be dysfunctional, causing impaired function in major domains, for instance, social, occupational, academic, and in activities of daily living. Brief psychotic disorder is a condition in which the individual presents with psychosis that has a duration of greater than 1 day but less than 1 month. The individual must present with one or more symptoms in the psychosis syndrome, with at least one symptom being delusions, hallucinations, or disorganized speech. Brief psychotic disorder is specified as with marked stressor or trauma, often referred to as brief reactive psychosis, without marked stressor or trauma, or with postpartum onset, occurring within 4 weeks of delivery. Schizophreniform disorder is a condition in which the individual experiences the psychosis syndrome for a duration of greater than 1 month but less than 6 months. This diagnosis requires at least one of the psychosis syndrome symptoms, one of which being delusions, hallucinations, or disorganized speech. Negative symptoms may also be present. Schizophreniform disorder is specified based on prognostic features. With good prognostic features means that 2 of the following are present. Onset of predominant psychotic symptoms within 4 weeks of the first sign of unusual behavior. Confusion or perplexity. Satisfactory premorbid social and occupational function. And absence of blunted or flat affect. Without good prognostic features, applies to individuals that do not demonstrate two or more of the previously mentioned features. These prognostic features also apply to schizophrenia, which we will discuss next. Schizophrenia is a condition in which the individual experiences the psychosis syndrome for a duration of greater than 6 months. As discussed with the previous conditions, this diagnosis requires at least one of the psychosis syndrome symptoms, one of which being delusions, hallucinations, or disorganized speech. Negative symptoms are likely present. Note that prodromal symptoms often precede the active phase, and residual symptoms may follow it. These are both characterized by mild or subthreshold forms of hallucinations or delusions. The first psychotic episode in enduring psychotic illness, such as schizophrenia, has its onset typically between the ages of 18 and 25. This onset corresponds with our stress diathesis model, where an ultimate encounter of stress around this age activates underlying vulnerabilities. The onset can be abrupt or insidious with a 50-50 split. Often the development of negative and cognitive symptoms precedes the presence of positive symptoms. The earlier the episode, the worse the outcomes. This also applies to schizophreniform disorder. Delusional disorder is a condition in which the individual experiences only delusions out of the psychosis syndrome for a duration of greater than 1 month. The individual must have one or more delusions, and full criteria for schizophrenia has never been met. Aside from the delusion or delusions, functioning is not obviously impaired and behavior is not noticeably strange. Any manic or major depressive episodes have been brief compared to the length of the delusional period. In major depressive disorder with psychotic features, the individual experiences psychosis that is mood congruent, meaning it aligns with the individual's current mood state. Psychosis here only occurs in the context of a depressive episode, and there is no psychosis during euthymia or normal mood. For a diagnosis of major depressive disorder, the individual requires 5 of the criteria included in the Sig-E-CAPS mnemonic. There must also be an absence of manic or hypomanic symptoms. Like major depressive disorder with psychotic features, bipolar disorder with psychotic features presents with mood-congruent psychosis. There can be psychosis with depressive episodes and especially manic episodes, but there is no psychosis between episodes or during a state of euthymia. For a diagnosis of bipolar disorder, the individual must have a history of 3 or more of the dig-fast symptoms, as well as a history of 5 or more of the Sig-E-CAPS symptoms. In schizoaffective disorder, the major differentiating factor here is the presence of persistent psychosis at baseline. There are manic and/or depressive episodes, but psychosis persists during the state of euthymia. Specifically, according to the DSM, hallucinations and delusions must occur for 2 or more weeks in the absence of major mood episodes. This diagnosis requires at least one of the psychosis syndrome symptoms, one of which being delusions, hallucinations, or disorganized speech. Negative symptoms are likely present. This image summarizes the differential diagnosis for primary psychosis. Note that I have included substance-induced psychosis at the bottom, as this is included in the DSM. The key differentiating factor here is the presence of substance use preceding the onset of psychosis. For a more detailed discussion of substances that are implicated in psychosis, review the lecture emphasizing secondary psychosis. For downloadable content such as written notes, PowerPoint slides, and more related to this lecture series, please visit my website using the link below. You can also support my goal of continuing to provide new content through Patreon, where becoming a patron will provide you with access to downloadable content as I create new content. Thank you for your support. My primary reference for this lecture was the Diagnostic and Statistical Manual of Mental Disorders, or DSM, 5th edition. Thank you for listening.